Want to live longer and better? I'm Dr. Jess. I'm a physical therapist, and in this podcast, I bring you real, science-backed strategies from physical health providers, mental health providers, and nutrition experts, so you can build strength, protect your mind, and fuel your body for decades to come. Longevity starts here. Pain is something that is very common in this country and across the world. It affects, on a day-to-day basis, 1 in 4 people, and 1 in 12 individuals are actually affected in the mobility and their activities of daily living. So what this means is that 1 in 12 people at any point in time are not able to move like they want to move because of pain. That's incredible. And so when we're talking about in this podcast, longevity and movement and how great exercise is for you and barriers that we're covering this month, pain is a huge topic that needs to be uncovered a little bit more. There's more to pain than what I think we realize. And that's the point of the topic. So by the end of this episode, I want you to really understand that pain is much more complex than we realize. And it doesn't really have to be, in many cases, as limiting as it is.
Absolutely.
So with me today, I've got Sarah Montgomery. She is a licensed mental health counselor. And so I love bringing in the mental health aspect into what we're talking about, because our mindset affects so much of how we actually look at any issue, whether it's pain or lifestyle change or goal setting or whatever it might be. So again, I'm going to say 1 in 12 people aren't moving on the day-to-day basis because of pain like they maybe want to or know they should be moving. And so why is pain so common? And I'm talking about musculoskeletal pain, not like organ-related pain, things like that. So musculoskeletal meaning pain that's coming from bones, ligaments, joints, soft tissue, muscle, things like that. So oftentimes we have musculoskeletal pain that persists or is chronic because the diagnosis and treatment plan is not yet figured out. So this is typically not something that you need to live with forever. I treat musculoskeletal pain all day long. I work with people that have been in pain for 30 seconds, all the way to people that have been in pain for decades. And many, many times the issue has been that the diagnostics have not been complete and the intervention plan is not robust enough for the individual, which is why the pain has persisted. And this is what we call chronic pain. And so I think you hear chronic pain.
Right.
Does that sound to you like it's curable?
I don't know, Jess. It depends on the person that you're talking to and what their mindset is and what their attitude is like.
It doesn't sound curable.
No, it sounds depressing. It sounds like something you're to live with forever.
Yeah.
It sounds like it's something that's not going to go away.
Right.
Or if it would, it's going to take a long time to go away.
Or it would have by now, right? And this is something that I'm always working on mindset with my patients, that this can go away. And they're like,
yeah,
no, I have arthritis. Therefore, it's not going to go away. Like, right. But your arthritis is on the other side of the knee. It's on the medial joint line, and your pain is on the outside of the knee. Oh, right. So what if you had arthritis and a patellar tracking issue? Could you have both at the same time? You're like, yes. I'm like, exactly. So there are often times where we go to the doctor, we're in pain. Sarah's like, my knee hurts, right? She goes to primary care, orthopedic, whoever. They're like, oh, let's order an x-ray. I'm like, ooh, Sarah, you've got arthritis. And she's like, what? So may or may not prescribe PT,
right.
Might kind of tell you, oh, you might want to lose weight. You might want to exercise more. You might want to, who knows, give you a couple things, take an anti-inflammatory, give you a shot, something like that. But here's the thing. Why would Sarah only have pain in one knee, right?
Right.
Why only arthritis in one knee? So if she's going about her day, walking and running and jumping and bouncing and living her life, wouldn't both knees have arthritis if we had breakdown, So oftentimes we get a diagnosis and we stick it on as a label. Yep. I'm arthritic. I have fibromyalgia. I have degenerative disc disease. And this becomes our identity. Yeah. It's how we live our life. And it affects our belief system.
100%.
And that is the mental health part of it, of
Mhm.
these identities that we put on, and then we believe that we have to hold this
Yep.
as our truth and our our definition of this diagnosis equals I can't insert blank,
Right.
whatever that I can't is,
Mhm.
because I'll be in pain.
Right.
So so now that kind of goes into, well, why do these labels matter? Like, is it
Mhm.
garbage that you got diagnosed with arthritis? No, that's data, right?
Mhm.
Now we know, okay, well, like your joint line's already kind of collapsed on that side. So a couple things we want to be careful about here. So that data is really important data to know. Um, and at the same time, understanding the biomechanical chain and understanding why did that inside joint line break down so much
Mhm.
faster than the other side
Yep.
or so much faster than the other side of the joint line of the knee.
Right.
Why? Like, you didn't, like, just, like a lightning bolt strike inside of your knee and just, like, break it down, you know? So, that's the missing piece that I see in so many of my patients. An easy example to kind of I like to pick on knees because it's one of those common diagnoses, like, who doesn't have knee arthritis if you're, like, above 50? Like, "Oh, that's me," you know? And I'm like, "I don't care. Like, you're still gonna hit your goals." So unless it's really, really bad, and then yes, get a total knee replacement because it will change your life and you will be able to walk again and you won't be
Right.
suffering, which does happen. But if you're just like generalized knee ache, knee pain, so why only, let's say, the right side? Well, an example is that if your foot and ankle has a tendency to go a little too far in or a little too far out, that would be supination or pronation. I've got a bone that articulates with that. That's my shin bone. So if my foot goes in, my shin bone comes in. Well, what does my shin bone articulate with? My femur. What's in the middle? My knee. So the minute that my foot turns in too much, my knee is going to start to collapse inward and
Mhm.
I'm going to wear down the inside of my knee faster. So it doesn't matter how many shots you put in that knee. If you don't fix that ankle, it's just going to keep breaking down, you know? So you might need to put in an insert on that side. You need to strengthen your arch on that side. That's just one example. It could be hip weakness does the same thing, but from the other side. So now the femur or the long bone in your leg starts to come in when you stand on that leg because the hip's not holding you up. Well, now that puts that stress onto the knee, but in a different direction. So that's another really, really common thing that happens. Because who goes to the gym and works their deep hip staplers?
Most people don't even know what that means when you say that. They hear that and they're like, "What?" I don't even know.
Exactly. I didn't know that before I went to PT school. Like, I played all sorts of sports. I worked out and I was like, wait, what?
Well, and I think
Like,
that in and of itself can be a big barrier is doctors, therapists, whatever your diagnosis is that you're going in for whatever your issue is, there's not enough education behind it to understand what's really going on
right,
and to even understand, like Dr. Jess was just explaining, if you're even looking in the right area for the diagnosis.
right. But why did it happen?
Right.
So we can treat the symptom, but
Mhm.
we don't always treat the why, which is why the pain persists
Mhm.
in many, many cases. And so this is one thing that I really try and get people to understand is that if you don't know why this happened and nobody has explained that to you, I challenge you, go find somebody that can help you figure out why, whether
Mhm.
that's a good physician, a good orthopedic, a good physical therapist, a good chiropractor who understands orthopedics and extremities, especially, which would be legs and arms. So find somebody that can really explain, where did this come from? Why did it only happen on one side of my body? And if they can break that down and explain it to you versus just taking a picture and saying, oh, look,
Mhm.
it's just not enough to get you to the point where you're going to get the function that you want, which is being able to do what you want, whether you want
Right.
to walk, whether you want to travel, whether you want to be able to, like, get on and off of the floor with your kids, whether you want to chase them on the playground, whether you want to be a
Mhm.
coach. Like, it doesn't matter what your why is, it matters to you, which means it
Correct.
should matter to your provider. So that's like a huge,
Yeah.
huge thing that I see all the time. So please don't think that just because you have pain means that it has to persist.
Right.
It really doesn't always. There are things that are irreversible. That
Mhm.
does happen. And most of the time, that's not the case.
Right.
Like, it really isn't. I see people that have been, like, I've worked with many people that haven't been able to run for the last 20 years because they were told, like, you have knee pain, running's bad, don't run. And then it was just biomechanical issues like length discrepancy, maybe pelvic torsion, some weakness in the hips, imbalances. We get it going, and like I've got like one gal. She's now on training for her second marathon. She ran 2 half marathons. So this was like 5 years ago
Right.
that I got her back to running. She's crushing it. She's only in her 40s,
Mm,
So it's
that's
like,
exciting.
and she loves running. So like, I don't care what it is. If you love it, let's do it.
Mhm.
You know. So now let's think, what are other issues? Why else would persistent pain continue that would stop you from doing what you want to do in this active lifestyle thing that we try and strive for? This 150 minutes a week of activity that's going
Right.
to keep our heart healthy and prevent Alzheimer's and make
Mhm.
sure we don't die of a heart attack prematurely, things like that. Because we know movement means that our brain stays healthy, our heart stays healthy,
Mm.
our lungs stay healthy, our organs stay healthy, right? Our bones stay healthy. We don't get compression fractures in our bones. So if we know movement equals all of that gain, then there are barriers that are getting in the way. And
Mm,
so with pain being a huge one. So another thing that I see a lot, and I'm sure you do too, are the what we would call lifestyle factors.
mm.
And this is not a blame game, okay? It's not a blame game. What I mean by lifestyle factors are things that we are doing on a day-to-day basis that are contributing to keeping you in the pain cycle.
Mm,
And oftentimes they seem benign,
right.
and many times they're not. So, how many of your people sit all day at a
Right.
desk to work?
Most of them sit all day at a desk to work, and then they're sitting again if they come and see me
Right.
virtually.
Mhm.
They're still sitting at their desk or on the couch at home. It's still in a sitting position.
Right.
So,
And then you sit to commute,
mhm,
you sit to eat dinner, you sit at the end of the day to kind of relax, watch a show,
yes.
right?
If you have kids at their sports games or various events, you're sitting.
Then you sit.
Mhm.
And so, and when they say sitting is the new smoking, the reason why, because legitimately that it is the new smoking, it is killing our bodies, is that our hips are in a flexed position when we sit. So they're in this 90-degree angle when we sit. We are sitting right now. Okay. The goal is to get position change, right? So stand up, sit down, walk, stand up, sit down, walk, stand up, so that constant change of position is what's really healthy. So
Right.
when our hips are in 90 degrees of flexion or they're bent, the muscles on the front of our hips are hip flexors. Those hip flexors attach to the front of our spine. Okay. And then our spine is in a little bit of flexion typically, which increases the stress on the discs in our back. And when we sit, it's not just like this linear increase in stress from standing, walking to sitting. It actually increases exponentially,
Mhm.
right? And if we sit in what we call slump sit posture, which is where we kind of round the pelvis underneath us, and we do that, gravity's pushing me down. I don't really feel like fighting it anymore. That skyrockets the pressure on our discs. So if we want to break our discs down rapidly over time, sit in a slump sit posture, which how many of our cars encourage a slump sit?
Right.
Because the seats are those bucket seats and they all put our pelvis into a
Mhm.
posterior rotation, which flexes our spine, which increases stress on the discs,
Right.
which creates more pain. I go into so many of my patients' cars and we work on adjusting their seat because their back hurts when they drive.
Right.
And we do everything we can to get them as neutral as possible. So not only are we increasing pressure on the discs, but we're shortening the hip flexors, which pull the spine more forward, which further compresses it. So we're in this cyclic loop, right? In addition to just the deconditioning that happens, right? So when we stand, our hip is going to be in a neutral position, and how we load onto our spine is typically going to be a little bit more neutral as long as we have good standing posture. Then when we walk, our hip goes into an extended position, and then our spine goes through gentle rotation.
Mm,
So when
okay.
we walk, that's why it's the least amount of pressure on the discs. So you're getting gentle movement through every single joint in the spine, which are
Mhm.
called the facet joints. Every vertebrae, there's a joint in between them on both sides. So we're flushing every joint all the time with every step we take. And the hip is going through nice, gentle range of motion. So we prevent that hip flexor getting really tight and just
Mhm.
pulling on the back. So this is why walking is so vitally important for not only heart health, lung health, but spine health. And so being able to like walk during the day is not always super easy. In
Right.
my job, I can't like walk on a little pad while I treat patients. You know what I'm saying? Like you're
Nor do
like,
you have time to get out the door, like, ever.
right, yeah.
Very rare.
So some jobs are hard. I can sit and stand all day, but I
Mhm.
can't necessarily walk, which is why I have to do that either before or after work or both,
Mhm.
depending on what I have. But a lot of jobs, you can be at a desk. You can have a
Yes.
walking pad underneath you. So there's things that we can do even if you can't get the walking pad, like I really encourage a lot of my patients. You can do what I do, like even just a little bit in the morning and then a little bit later after you eat, do a little
Or
bit of
even those
walking.
breaks. You have standing desks here for all
Mhm.
of your employees, and I know a lot of, offices have that now as well
Well, I
for
have a
you to be
standing
able to do,
desk, yeah, so
but they have the ones that literally
stand all the way up.
can lift up and down, like, as you're working throughout your day, so you're
Yeah,
not in that sedentary position all day long.
yeah, and you're just
So
changing the position on the stress
mhm,
on our bodies.
mhm,
But that could be how we sleep. Like if we sleep in a really awkward position and then it's like creating pain. I feel fine. I wake up in the morning and I have a bunch of pain.
right.
So positionally, how you're sleeping could be part of it. What
Yeah.
does your pillow look like? What does you're sleeping like this and your wrists are curled up and then now your carpal tunnel is really worse in the morning. Well, yeah, that's because you were like this all night and your wrists were flexed
It
and
was
tucked
so
underneath you.
comfy.
It was, but now you don't wanna get up in the morning and, like, do any of your strengthening routines because your hands are zinging you, right?
Mhm.
So, it could be something ergonomic. This is all lifestyle. Like, and it seems benign. You mean how I sleep is making me
Right.
worse?
And
Yeah,
I think the good thing to remember is that it seems benign, it's not. It's actually creating that change over time that then becomes that big change that often patients come in to see Dr. Jess for. But everything that she's talking about are small changes,
yeah,
right? They're just
yeah,
little things you have to shift. So even though it may seem like a big barrier, at the same time, this isn't a giant leap that you're having to take to make these changes to be able to allow your body to feel more comfortable and more like, let's just say, at home in itself versus in that chronic pain state.
right. Because I know for sure, like, I've had one episode where my elbow, because of the mouse I was using, I was creating the website for the clinic,
Mm.
and I was, like, on the computer way more than I normally am, and my forearm was, like,
Mhm.
I mean, fire
Yeah.
was coming.
I feel
Oh
that.
my gosh, I was like, "Dang."
Mhm.
There was, like, no way I was gonna, like, go lift weights, like,
You did all that for the
oh
day.
my gosh, right? So it's like, there's times where I'm like, "I get it."
Yeah.
Like, "Don't touch my arm,"
Yeah, right, back
So,
away.
yeah. So that was a lifestyle change that I had to
Mhm.
make. I changed my mouse to a vertical mouse, an ergonomic mouse, which helped tremendously. I treated my own elbow. I do know how to do these things. And then and then I got rid of it pretty quickly, but that I do have that knowledge, which is helpful. But that's the next thing that I want to
Mm.
cover is knowledge.
Right.
Is that we don't always have all of the knowledge to understand why something is happening, how
Mhm.
to diagnose this, what to do about it, and then to implement a plan that will work. And that's frustrating because now I'm a little bit dependent on other people around me, and that's why we live in a community,
Yeah.
right? I don't have all the mental health answers, which is why we've got Sarah here,
Mhm.
right? A lot of stuff I'm like, whoa, above my pay grade. Yeah, we got to go over here. Yeah. And it's okay to ask for help from
Mhm.
people around you.
100%.
Does somebody else have you experienced this before? Did something help you? Like, get some word of mouth. Like, is there a provider that you can recommend me to, or whatever it might be?
Yeah.
But just because one or two individuals, providers typically is what I'm referring to, haven't been able to help you,
Right.
doesn't mean you can't be helped.
Yes, and I'm
Yeah.
gonna speak in kind of side note on the mental health side. I tell my clients all the time, if you don't like what I'm doing, please tell me. If you don't think this is working, if you want to try out another therapist because you think it's going to work better for you, please do so. You only have one life. Let's live it to our best and our fullest and our healthiest. So, in the same respect, Dr. Jess and I have talked about before, if they don't want to come see her, it's okay.
Yeah.
She is the best at what she does,
And
but
like,
we get it. We want them to be we want our patients to be comfortable and
absolutely.
to see the results that they're looking for whatever their goal is.
Right. And it's not personal.
Right.
So like if someone comes to me and they're like, my expectation is X, Y, and Z, and you're not meeting that expectation, I'm like, 100%. I will tell you from my point of view, here's
Mhm,
what I can do.
mhm.
That might be faster than what I can do from a physiologic basis. You might be asking for more time than I have available, right?
Yeah.
You might need a time of day that I don't have available. I can't
Mhm.
meet that expectation, and that's okay,
Yep,
right? You found a clinic down the street that can meet these. I really hope you feel better.
yep.
No feelings are hurt. Like I just want you to feel better.
Mhm.
So it's okay to like look around and find somebody that you jive with that gets you that can then help you get to where you
Right.
want to go. But I mean, I've got one lady now. I mean, she's been to like I don't even know so many doctors. I mean, she came
Mhm.
in, there's still undiagnosed stuff going on. I was like, you don't yet have your
Mm,
answer. It's not yet. I was like, you have to get onto wait list, get on the cancellation list,
yep.
like keep calling, keep asking. And then finally, we've been working together for months and months and months. Super weird stuff is going on. She got a diagnosis
Mm.
and it's treatable.
It's
Like,
awesome.
it's such a big deal. And they're like, thank you for pushing us to, it's not yet.
You have to be your
Not yet.
best advocate
Yes.
when it comes to physical health, mental health, whatever it may be, and keep, in a sense, fighting to get those answers.
Mhm.
Because, like I said, I want to live my life in the best way possible. I'm still working on it, but
Yeah. Well, we're always
you
working
know,
on it. We're always on a journey,
we
you know?
are. But don't
Yeah.
let that be a barrier. Don't let that chronic pain and not having the enough information or enough answers be a barrier to stop looking for them.
Right. And so another thing that happens that keeps people in pain that persists, because I kind of like saying that better than chronic pain, pain that persists. Doesn't it sound better?
It does. It doesn't sound
Yeah.
as scary.
Right.
Yeah.
Yeah. So is the negative feedback loop that
Mm,
happens. So
okay.
let's say my neck hurts, right? So my neck hurts and I go to the gym. I'm like, I'm forcing myself to go. I'm supposed to do this, right? Uh, and I start lifting weights, right? Now I'm already tense because my neck is hurting. I lift some weights and I'm going to guard where I'm in pain. And
Mhm.
now my pain is worse,
Right.
right? So I just kind of kept myself in this negative feedback loop because I didn't do anything to break my cycle,
Mm,
right? So if like you're kind of always in pain and it's always there and you're never really doing something to like fully disrupt the cycle,
mhm.
bodies are really good at going
Yeah.
and they just hold. So it could be emotional trauma. This is very common when we talk
Mhm.
about fibromyalgia, like pain
Yeah.
that persists. Typically, we bring all the way back to whatever the trauma was.
Mhm.
I always tell people, You don't have to tell me. Okay, like, unpack that with your mental health counselor." But we know before this, there's car accident, all sorts of things. Now, there could have been physical injury that was sustained.
Right.
I see this a lot with car accidents because it's like, wham! I mean, just
Mhm.
bam! All of a sudden, it's loud, it's
Right.
traumatic. There's potentially you were rushed off in an ambulance. Everything's going on. You're out of control. Surgery. You're in the hospital. You went from being normal functioning to I can't move.
Right.
That is a crazy amount for your brain to process.
Yep.
So now it's 20 years later. Why does your neck still hurt?
Mhm.
Okay.
Oh, okay.
Yeah.
Let's think back
Right.
now. I do this with my clients too. Let's look back.
Yep. Yep. And it could have been that. It could have been who knows what, right?
Mhm.
Um, so did the body go into a guard that it's like, I never want that to happen again. I
Mm.
never want that injury to
Mhm.
happen again. And so there's no higher level of function in our muscles. Okay.
Yeah.
They don't go, oh, wait, if I do this, I'm going to give the person a headache every day.
Right.
Right? The muscles don't know that.
Mhm.
Our cortex of our brain is sending the signal.
Right.
So this is part of just our nervous system and learning how to chill versus upregulate,
Right.
right? And learning how to break that cycle
Mhm.
is hard. That is hard.
Right.
And it's possible.
It is
So,
possible.
yes.
It's okay for things to be hard.
Yes. Yeah.
I think that sometimes can get in the way of all of it.
Mhm.
So,
And this is where so much comes into mindset.
mhm.
So much comes into it. Is understanding, is what I'm doing going to create harm, or is
Mhm.
what I'm doing benign,
Mhm.
or is what I'm doing helpful? Huh.
Right. I always
Yeah.
ask, is it adding value or is it taking away?
Right.
Right.
So this person with this neck pain, right? They tell me, "Well, I don't walk for exercise because my neck hurts more." I'm like, "Okay, so that's okay, cool. Explain to me what happens when you walk." This was literally just, like, probably 2 weeks ago,
Mhm.
as somebody who legitimately, like, wants to age well. It's like, "But every time I walk, my neck hurts
Oh
more."
gosh.
Yeah. No, like, for real. This is upregulated. This
Mm.
happens all the time.
Yeah.
And so I was like, "Okay, so explain to me during the gait pattern, which is walking, when is the neck involved?" And he was like, "Right." I was like, "Okay, so we know that. So we're just gonna create some knowledge here, right? So we're just gonna build on that. So if the neck isn't involved, you're holding it upright against gravity, but you're doing that now sitting still.
Right.
And you're doing that now while you're just standing. Okay. So there's not a whole lot more when you
Mhm.
walk that would cause the neck to hurt. However, your breathing rate is going to increase when you walk. So if your breathing rate starts going up, do you start to tense?" It's like, maybe, you know?
Mm.
So I was like, "Have you had any issues in the past with like fainting episodes, any heart related issues, any heart scares?" Yeah, actually, I fainted recently, and
Mm.
they're doing a full cardiac workup on me. I was like, "Is everything fine?" "Yeah, everything's fine. He was just dehydrated." So
Okay.
now it
Some good
starts to go
answers.
up,
Mhm.
and now the upregulation starts, right? So it had nothing to do with mechanical neck pain, you know?
Mm.
So it had everything to do with I'm associating this is a fear avoidant association
Yep.
of like, am I gonna have a heart attack?
Right.
I'm fearful that it's like, but now let's use the data.
Mhm.
I mean, you might, let's look at the data. Like be careful. But if the data shows that the heart is healthy, you fainted because you're dehydrated,
Right.
it's Florida, it's summer, like you're
Yeah.
in the sun for a long time, you stand up, blood pressure drops, and boom, you faint, you
Yep.
know? So that was not we would not call that a cardiac event. So different. So all of these are times where we just need to like back up and say, where's my
Mhm.
negative feedback loop
Yep.
and what's contributing to this feedback loop? And I need to at some point put a little cog in that wheel, like
Yes.
jam it in
Yeah,
so
because
it
you're
stops.
when you're using that negative feedback loop, whether it's for a few weeks or months or years, your brain, remember, changes its actual chemistry to fit that narrative,
Right.
right? So that's why she's talking about, okay, what are we going to insert here from the knowledge that Dr. Jess gave me about, okay, it's not my heart, everything's fine. I was just dehydrated. It's not walking gives me neck pain. It's
Hmm.
just I needed some more nutrients. I needed some more H2O, right? I needed to prepare myself for this walk. Maybe I was a little bit stressed that day. Maybe I had a bad phone call before the walk, right? So
Right.
just looking at all of these external factors that are
Hmm.
playing into that negative feedback loop
Yeah.
can help reset and start that process of your brain being like, okay, it's not, I can walk. It's not going to be a bad thing. I don't have to be fearful anymore.
No.
Just need to carry my bottle of water and probably learn how to breathe.
Right, exactly, and just understanding why is it happening,
Hmm.
and then making a plan for it. Like, shove something into that wheel so it stops, keeping itself going.
Yep.
And so we all have negative feedback loops, by the way.
Hmm.
Like,
Yes.
and it's so much of it's mental. It affects our stress levels. It affects our movement. It affects our pain. That jaw pain that you get with that kind of like, oh, now
Hmm.
at the end of the day, my jaw hurts, my temples hurt, I get a headache.
Yep.
All of that is going to be negative feedback loops. And so interrupt, like be an interrupter
Hmm.
and see yourself as an interrupter. So that way you kind of define it of like, wait, I feel like this negative feedback loop is happening again, and I'm the only
Yes.
one that suffers.
Yeah.
Like, well, dang, you
Yeah,
know?
so recognizing those triggers for sure, depending on what it is that you're dealing with, to be able to insert and be like, hold up, it's starting again. I'm going back into the cycle. What
Right.
do I need to do to stop this
Yeah.
and start my new cycle or take a quick
Hmm.
break?
Because oftentimes what happens is once it starts again, we go into avoidance.
Yep.
Right? And so I don't wanna look at it. I don't wanna do this. This is hurting me. This is painful. This is
Hmm.
whatever, and I'm miserable, and I just wanna go into the dark and hide.
Yep.
And the issue is that that keeps you there,
Yeah.
right? So if you're trying to do something to help with your pain and you run away and hide from it, it never went away.
Mm-mm.
It's still there,
Right.
right?
Avoidance does not do anything.
Nope. Nope. You made no progress by doing that.
No.
And so this happens many times when people get started with exercise,
Hmm.
right? And movements of I start people from ground zero all the time.
Right.
All the time I hear, I can't do X because it will hurt my back.
Mhm.
That is a definition in the brain, right? And that will keep you in that negative feedback loop.
Yep.
So if you're doing a bridge, so you lie on your back, you squeeze your glutes, and you lift your pelvis up from the table, is there anything that could cause harm to your spine by doing that? Harm. Physiologically, you cannot.
Mhm.
Okay, you cannot. Now, can you fire muscles in your back while you're trying to do a hip extension exercise and create pain in those muscles because they're trying to do something that they physically cannot do?
Mhm.
Lumbar muscles don't cross the hip, so they can't create hip extension. So if they're trying to help you complete a bridge, that's a motor control problem.
Right.
That's not anything that will cause harm. And so, whenever you're getting started with exercise, or if you're trying to progress with exercise and you're having a hard time with getting out of a negative feedback loop or feeling like something's going to create harm, really try and think, could this create harm?
Mhm.
So if you have a barbell with 150 pounds right here on your neck, okay, and you try and do some squats and you already have degenerative disc disease in your neck, could that cause harm? Well, yeah,
Yep.
it actually could.
And with your neck like that too.
Yeah, see what I mean? Like that
Your whole form.
could cause harm.
Yes.
So really trying to understand, could this hurt me? Could it not?
Mhm.
So that's where you want to make sure, like, wait a minute, this doesn't make sense. This can't hurt me,
Yeah,
like, take it back. Take the power back.
absolutely.
Then you'll start to see the difference with how movement is actually medicine. Rest does not cure musculoskeletal pain. Movement is medicine. So anytime we have some sort of muscular imbalance or something is going on, we need to fill in the gaps. If you are just getting back into, you had an ankle sprain and you're getting back into running, if you wait to like start dynamic activity until you're in 0 out of 10 pain, you're going to be so delayed.
You're right.
Like if I have a resting ache at a 1 or 2 out of 10 and I do some dynamic warm-ups and some dynamic activities and I end and my ankle is a 2 out of 10, it didn't hurt it, right? I was 2 out of 10 to start, I'm 2 out of 10 to end. I didn't increase it. So I'm good to go. So I can progressively load even while I'm healing. But as long as I don't do a 2 to 3 to 4 to 5 to 6, and now I'm all sudden 6 out of 10, that's telling me my tissue's not ready for that activity yet.
Mhm.
But if I stay at a 2 out of 10, well, heaven forbid I end at a 0 out of 10
Yeah.
because the movement actually helped me.
Mhm.
So we don't wait until we're 0 out of 10 to move. So there's really important things with movement that actually helps with healing.
Yep.
And so whether it's backs, ankles, knees, hips, necks, it doesn't matter. Movement is medicine. And movement is longevity.
Mhm.
It's both. So the moral of the story is pain is a barrier to movement. Okay.
Mhm.
Mentally, mostly.
Yeah, I was
Like,
just about to say, yeah, mentally mostly we get in
yes,
our own way,
yes,
when we think chronic pain, yes, and then just pain in general. It's like the wincing, the thing, are we getting hurt again? Like anything that we do, it just completely cuts off. Nope, nope, not even gonna attempt that.
right. And that's where we modify.
Mhm.
We find what we can do versus focusing on what we can't do.
I love that.
So, and I have to like, shoot, if I've had a headache all day, Lord, do I feel like going for a run? Not really. Or if I wake up with a headache, I do not feel like going for a run. But 9 times out of 10, the headache's gone by the time I'm done.
Yeah. I can
So,
tell you any of the times I've avoided going to the gym and then I went anyway, I have never regretted it.
right.
No matter what state that I'm in, whether I'm in pain, whether I'm in a mood mentally. There was one time where my trainer was like, "You scheduled and canceled 3 different times within 30 minutes." I said, "I know. I know." And then I just gave up and it wouldn't let me anymore. So I'm here. I'm here.
Yeah.
They're like, "Okay, we're glad you're here. You're
Yeah.
glad you're here. Just go ahead and do it."
Right.
Um,
Yeah.
which I was battling with my own negative feedback loop. I was battling with my own barrier of being in a car accident, not being able to do deadlifts like I used to want to do,
Hmm.
and having to do lighter weight. But you know what? I just had to suck it up and realize I'm still working out. I'm
Right.
still getting the job done. I'm
Yep.
still here moving my
Hmm.
body, my muscles, my other parts of my body that I can take care of, even if I'm not able to still lift that heavy weight on my deadlift.
Yeah.
So,
Which is okay. A little bit of something is better than a whole lot of
yep.
nothing. And you're going to get there a lot faster by starting.
Yes.
So you got to start slow
Hmm.
and it'll build. It will. And you don't have to reach goal 10 when you're starting at 0 or 1.
Yeah.
So set the expectation of I'm okay with 1 or 2 out of 10 as
Mhm.
far as my intensity. That's okay. Like when I was postpartum,
Right.
mm, it wasn't a wog, and it wasn't well, no, it wasn't a jog, it wasn't a walk. I called it a wog, okay? And it wasn't pretty. It wasn't, and I was just like, "Don't look at me," right? 'Cause I was just, like, kinda shuffling, huh, 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 huh,
Mm,
I didn't feel good about myself. I felt sloppy, I felt fat, I felt not good, I just felt like, "Ugh, I'm weak?" It's like I don't know, somehow, like, when you're pregnant, you're like, "Ooh, yeah, I'm pregnant, I'm,
mhm.
like, doing good," you
Yeah,
know?
right.
And then you're postpartum, you're like, "I'm just fat." Like,
You're
I
like, "What am I
don't
supposed to do with
feel
all of this?"
good about myself right now.
Yeah.
I'm stretched out, my abdomen is stretched, my hips are weak.
Mhm.
I'm tired, like, I don't feel like me, and now I'm gonna walk with an audience of neighbors?
Who know
Lord.
I'm a great runner and train other people
Ugh,
and all these other
man.
things, right?
Like,
And now
like, feedback loop was going
yeah,
on, and
yeah,
that's where I had to challenge myself. "Listen, like,
yeah,
you were pregnant for 9 months. Your
yes,
abdomen stretched out.
yeah,
Like, it's gonna take you a minute. It's
right.
okay."
Yeah, and I think we
Like
can say in and of itself that time frame for chronic pain, whether it's from postpartum, car accidents, just long-term injuries, like whatever it may be, genetics, it will take time and that's okay. And I think as we've talked about in other episodes, we're such an instant gratification society
I want
that
that.
I would love to lose my 20 pounds like right now. Trust me, I could walk out this door and be 20 pounds lighter. Great. But I know that's
Absolutely.
unrealistic and I think the encouraging thing is it took time to get here, but it's not gonna take as long to reverse that thinking or create new thinking. It doesn't even have to be reversed.
Yeah, just
You
new.
can create new thinking patterns, just new patterns of exercise, whatever it may be, in order to reduce that chronic pain and actually just live your life and enjoy it and be happy.
Right. So the takeaways
Mm,
are if you don't yet know why you have pain,
mhm.
then try and work with somebody that can help you with the why.
Yep,
Why is this still happening? And then from there, you can actually make a plan for how to get it more under control.
yep,
The other thing is to see what are the lifestyle factors that could be contributing. So, is it that I'm sitting too much during the day, which is putting stress on my back? Is it how I'm sleeping, which is putting stress on my neck?
mhm.
That's me. Or my hands, things like that.
Mhm.
Any of these lifestyle factors that you can change. The other thing is arm yourself with knowledge. So, what could be things that could help me. And so that could be doing research, it could be talking to providers, it could be talking to community members, but knowledge is power. And
Absolutely.
so better understanding any of this is going to be helpful. And then finally, you've got to put a cog in that negative feedback loop. I
Mhm.
mean, when I say shove it, I mean just shove it in there and like disrupt.
Yeah.
Um, and it's like I've had to do it so many times to myself where I'm like, whoa,
Yeah, sit back and really
like,
see what you're doing to yourself.
you are not being very nice
Right.
to yourself right now.
Yeah.
And that's where I have to put the cog in the wheel and say, enough,
Yeah.
enough,
Yeah,
you
and
know?
I think you can do that through reminders on your phone, sticky notes around, just having like a note that you're taking with you everywhere, a note in your car. There's so many things that you can do to start that mindset differently so that you don't even have to necessarily start taking that step back because you're starting that negative feedback loop again though,
Right.
right? So,
So the moral of the story is pain is complicated
mhm.
and there's so much that goes into it and the physical response, the emotional response, the stress response all contribute to what you're feeling. And so really better understanding it is how you're going to get ahead of it.
Yep.
And having a good team around you is also typically helpful.
Yes.
So if you found this helpful or you can think of somebody in your life that this could help, please forward them this episode. It might make a difference for them, and then, like, subscribe, all the good things kind of helps us grow the channel. And stay tuned for next week. We've got more talks about berries.